Hi, thanks for taking the time to watch this video. My name is Dr. Prince Opon Checheku, and today I'm going to discuss or talk about the types of patients that we see in the hospital. Today I'm going to use a scenario to help you understand the concept better. Now, I've classified the types of patients into 3 categories, and I'm sure by the end of the discussion you would be able to put yourself into one of the categories and advise yourself appropriately. Now, I'm going to use a scenario to help us understand it better. So let's look at someone who owns a car as a scenario. Now, the first type of patient is the people I call waiters. So let's look at a person who owns a car and forgets or refuses to take the car to the auto mechanic shop for maintenance, and also is always unmindful of the fact that there's an electrical fault or has a cracked windscreen or something like that, and refuses to take the car to the auto mechanic shop for repairs. Now, you can compare this to someone who is always unmindful of his or her symptoms. Some people get symptoms of diseases and refuse to even, attend hospitals, go to the hospital, or even call their physicians. Now, some diseases or some medical conditions, such as hypertension or kidney diseases, mostly would typically not show you any symptoms. If you are lucky, you may get some headaches, palpitations, and some dizziness for hypertension. But for kidney diseases, most of the time, by the time you get getting these symptoms will be when it's already in the late stages. Now, let's look at the second type of patients. These are the patients I call the self-acclaimed physicians, or the self-acclaimed mechanics. Now, someone who owns a car gets a fault with the car and then try to mix something up and gets the car moving. So mostly they think that they know everything. Once they're able to do something to the car for it to move, they think they can do everything with the car. So whenever they get an issue with the car, instead of them to take it to the auto mechanic shop, they try and then do something to it and then see what that would give them. Now, this can also be compared to a patient or someone who gets symptoms and then quickly runs to the pharmacy to get some drugs to alleviate these symptoms. But then they keep doing this until it gets to a point where whatever medication they are taking is not able to reduce whatever symptoms they are getting. That is the point that they realize they need to visit the hospital. And mostly by the time it gets to that stage, they've already developed some complications, or they've already got into the severe forms of some diseases. Now, let's look at the final category of patients. These are the ones I call the obedient ones. Now, someone who owns a car and always takes the car to the auto mechanic shop for maintenance works to be done. The moment they get an issue with the car, they take it to the auto mechanic shop, or they call their mechanics to attend to their cars. Now, you can compare this to someone who is always going to the hospital for medical checkups and also attend screening programs to see whatever is wrong with them, and also seek medical attention whenever it's appropriate. And then these are the same people who would always come to the hospital whenever they get a minor symptom, or whenever they get an issue. Now, what is good with these people is that whatever issue they are having, it's going to be picked up early, and the appropriate intervention is going to be administered to them. So these are, in short, these are the types of patients that we normally see at the hospital. And I think by now, or I guess by now, you are trying to put yourself into one of these categories, and you need to advise yourself if you are one of the waiters or you are one of the self-acclaimed doctors. Your health is you, and your health should be an utmost concern to you. Let's stay healthy and be good. Thank you for watching once again, and stay tuned for more.